Hey, I'm Dr. Shook, and in this video I'm going to share with you very quickly the things that you can do on your own to address psoriasis from a root cause perspective. I'm going to talk to you about and give you information on testing that you can self-order to help you understand triggers and drivers of psoriasis. And then if you need help, I'm available via telemedicine, and that's also another option, but I'm going to give you everything that I can right now to help you help yourself. So first of all, I'm Dr. Shook. I'm a certified functional medicine clinician. I have psoriasis. I've had psoriasis since I was about 24 years old. I am now 47. My mother has had plaque psoriasis for the last 30 years, severe plaque psoriasis to the point that she had to go on a biologic medication, and I've worked with a lot of people that are autoimmune, that have autoimmune thyroid conditions, autoimmune psoriasis, that have Crohn's disease, ulcerative colitis, rheumatoid arthritis, other connective tissue autoimmune diseases. So I have dedicated my life and my functional medicine studies into understanding and trying to learn as much as I can about the triggers and drivers of autoimmunity. And in general, there is the leading edge science and model on autoimmunity is this model called the environmentally induced model of autoimmunity. This is a model that's been developed by immunologists, the doctors that actually study the immune system and that are doing laboratory experiments. So we're learning from, and I'm learning from, the people that are on the front line doing laboratory research into what are the drivers of autoimmune disease. And autoimmunity in general is where your body attacks itself. Your immune system attacks you mistakenly. And this is due to a few different things. So this model of autoimmunity, called the environmentally based model of autoimmunity, is where things from the environment trigger the immune system to react against your tissues mistakenly. Okay, so there are three major components that have to occur. Three things have to occur so that your immune system starts attacking you. So number one, there have to be triggers. So the triggers for autoimmunity, as immunologists and the immunological literature shows us, that there are three major categories. There are foods and food proteins. So proteins in the food get into the bloodstream before they should be there, typically because your intestinal barrier breaks down. Now, this is something we'll talk about in a second, your barrier systems, which are critical. But the triggers, food proteins. So food proteins make their way into the bloodstream before they should be there. The immune system doesn't know what they are, so it starts reacting, and it starts making tags that circulate through the bloodstream and stick to things that are foreign. Now, if these food proteins are present, then you make antibodies, and the antibodies are in the blood. Antibodies are things that the immune system make that's kind of like a post-it note, or it's a key. It sticks to the thing that it's made to mark. It is a marker. And once the antibody sticks to the thing that is foreign, like a food protein, for example, then other immune cells can very quickly identify it, they can mobilize, and they can destroy it. So it is a way for the immune system to more efficiently tag and identify things that are foreign, so that other immune cells that come and kill things and destroy them can do it with efficiency. Okay? So food proteins get into the bloodstream, they trigger an immune response, the immune system makes these antibodies, and while these antibodies are in circulation, they can tag your tissues. Some antibodies are made for certain proteins. Like, let's use gluten as an example. So gluten is a common protein. You hear, people are gluten-free, and for good reason. Gluten, there's a ton of problems. I've done a lot of videos on gluten, and to make this more concise, let's not talk about that except to say gluten protein, the proteins in wheat, which the primary one is gluten, that's the protein, it has a structure or a shape that is similar to a lot of your own tissues. So when your immune system makes an antibody that can stick to the gluten, that same antibody, as it's circulating through your circulatory system, if it comes across a tissue protein, like we know, for example, thyroid peroxidase, or TPO, it's an enzyme in the thyroid. We know that there are neurological proteins in the brain that gluten antibodies can cross-react or bind to. That's what it means when it cross-reacts. So the immune system making antibodies to help eliminate, let's say, gluten protein, which gets into the bloodstream before it should, these antibodies in circulation may actually stick to your own tissues because they're similar and they have similar proteins to the thing that the immune system's trying to eliminate, like the gluten, for example, gluten protein. So this antibody can mistakenly tag your tissues. This is called molecular mimicry. So your tissues mimic the have mimicry or similarities so close that the immune system can't tell it apart from gluten or from your tissues. So this is one of the mechanisms. It's called molecular mimicry, where the immune system can actually start attacking you. So triggers: food proteins, pathogens. So there are numerous pathogens. You just look them up. Look up any kind of virus that you want to look up. Look up Epstein-Barr virus. Look up H. pylori infections, the most common bacterial infection in humans, H. pylori. You can look up Yersinia enterocolitica. You can look up Streptococcus virus. Just type in H. pylori autoimmune trigger, and you will find a list. You'll find literature on PubMed, which is the index medical literature. You will find tons and tons of information on just about every pathogen, every bacteria, every virus, every fungal infection, every parasite out there that they're known to be triggers and perpetuators of autoimmune diseases. So pathogens can also initiate the autoimmune process. So this is through similar mechanisms. There are different ones that we could, you can get very technical with it, but basically pathogens, you can either, your immune system will make antibodies against them, and the same thing can happen as we explained with the gluten story, or these pathogens can get into your tissues and your immune system can react to those tissues and can start reacting to the pathogen embedded in the tissue and then start mistakenly attacking your own tissues because they're just in the proximity of the pathogen that's in the tissue. This is called a bystander effect. Okay, so it's just attacked because it's in the vicinity, right? There's a bystander effect. There are many ways. There are mechanisms through which the immune system can start attacking your tissues. For simplicity, though, let's not discuss those in great detail here. I'm happy to answer those questions. If you have them, you can post them in the comments of this video if you're watching on any of the platforms, YouTube or whatnot. So you've got triggers. You've got food proteins, primarily food proteins. You have pathogens, right? Bacteria, viruses, fungi, parasites. They can all trigger and drive autoimmune processes. And then you have chemicals. Now chemicals wreak havoc on our body many ways, but one way that not a lot of people are aware of is that they can actually trigger autoimmunity. They come into the body and they can bind to your tissues, stick to your tissues, and they make this new complex, chemical plus your tissue, and it makes this new complex that the immune system can't recognize. It's called a neo, meaning new, antigen, foreign. And this new complex, now the immune system, when it sees it, it doesn't know what it is, so it starts reacting against it and starts making antibodies against the chemical tissue complex. And this can result in the immune system attacking your tissues because it's part of that complex, so it can't tell them apart. This can cause an initiation of autoimmunity. Now, chemicals can do many other things. They can disrupt our endocrine system. They can mimic our endocrine system, so they can mimic estrogens, as many herbicides and pesticides do. But again, so we don't digress too far, we're just talking about the immune system. What are the known triggers and drivers of autoimmunity? And specifically, we want to talk about psoriasis here. So we've talked about food proteins, we've talked about pathogens, we've talked about chemicals. Those are the umbrella term, or the umbrella, what we can say as known triggers. Okay, so those are the triggers. Now there are two other major components that make up this environmentally induced autoimmune model. So you've got the triggers and the drivers. Okay, so that's what we talked about: food proteins, pathogens, chemicals. Now there's another key component here. These are the barrier systems, the immune barrier systems. Now you might not know this, but your body has many immune barriers. Basically, an immune barrier is where the outside world meets the inside world, and it's an interface. It's typically your mucous membranes. So anything inside the mouth, up in your nose, your entire digestive tract, all the way through, is a mucous membrane. It is a selectively permeable barrier system, so it lets things into the bloodstream that should help the body to repair and function normally, and it should keep things out that would otherwise do the body or the immune system harm. When these barrier systems break down, let's just stay on one that's very commonly discussed, at least in the functional medicine world, and that is the intestinal barrier system. When the lay term for this is leaky gut, and it's where the intestinal barrier becomes permeable, and it lets things in the intestinal tract pass through into the bloodstream before it should be there, like food proteins we talked about, like bacterial fragments that could pass into the bloodstream from the GI tract, because we know what the GI tract is loaded with bacteria. We know that there are a lot of bacteria there. That's called the microbiome. That's totally normal. But this is, these barrier systems, when they break down, they can be, and this is an essential component to typically developing an autoimmune disease. Now, there are many barrier systems. Some people have autoimmunity, and it was never their intestinal barrier that broke down. It was maybe their skin barrier. Because when you have open lesions with, like you do with psoriasis or eczema, you actually have a gateway so things in the environment can pass directly into the bloodstream. Now, you also have a nasopharynx, this area up in the sinuses. You have a lung barrier. You have your gums are a barrier system too. Everywhere you have a mucous membrane. I mean, you have a microbiome and a barrier system for your eyes. There are barrier systems anywhere the outside world meets our body. Basically, that's a barrier system. Now, the gut barrier is a common one that breaks down because it is being assaulted every day by the food that we eat, the water that we drink. It is being bombarded, I should say. So that is a common place. These barrier systems, we can assess them. We can also just make some, if we don't have access to testing, or if that's outside of someone's budget, then there are things that you can do from a trial and error perspective, like change dietary strategies temporarily to see what kind of impact that has, because a lot of times that can improve the gut. That oftentimes will improve the barrier function. That oftentimes will help to calm down the immune system. And that can change the microbiome or the gut bacteria as well, which has a very strong influence on the immune system. Now, the third component here, we've talked about the barrier systems, the triggers and drivers, right? Now, the third part of the environmentally induced model of autoimmunity is immune system dysregulation. Dysregulation just means the immune system doesn't function normally. So normal immune function is when something comes into the body that it should react to that's foreign, it should mobilize an immune response. It should increase inflammation, identify the thing that's foreign, destroy it, clear it, and then once the thing is cleared, the foreign thing is cleared from the body, the immune response lowers. And you come back to a low state of inflammation and a baseline of monitoring and surveying with a low inflammatory state. When a lot of people that are autoimmune, their immune system does not either mobilize the inflammatory response properly, it doesn't create inflammation properly, or really commonly is it does not resolve the inflammatory response. And then you have this dysfunction. Now, what can cause immune system dysregulation? Well, a lot of things can cause immune dysregulation, unfortunately. Number one, deficiencies, vitamin D deficiencies, any of your fat-soluble vitamins, but primarily vitamin D and vitamin A are critical. You also, essential fatty acids like omega-3 fats, a lot of people are deficient in those and have higher omega-6s, and they're in a pro-inflammatory state. These are things that can be major issues for the immune system. Your vitamin and mineral status is critical. Magnesium, zinc, selenium, a lot of the B vitamins, these are critical for normal biochemistry and immune function to occur. So you can obviously test those things, but you can also make some assumptions and take some vitamins and stuff if you don't, again, have a budget to do a bunch of testing. There are things that you can totally just do with diet and try to make a difference, and a lot of times it will help significantly. Then there are layers of, like, you could add on like a supplementation protocol layer, even trial and error based, just based on symptoms alone, which I've worked with a lot of people and done that when we don't have budgets to go deeper with testing. And then, without digressing into treatment or the ways to approach this, the last thing with this immune dysregulation, chemicals. We talked about how chemicals can drive an autoimmunity, but chemicals can also directly bind to your white blood cells, to your immune cells, and cause dysfunction. They could make them not respond as they should, or they could make them overly aggressive. So you can have immune dysregulation that way. You can have immune dysregulation from not sleeping. So sleep is something when I work with someone, we try to optimize all of these aspects of their health that are critical for normal immune function. So sleep and optimizing sleep is one of the things we really try to focus on. And it could, because it's absolutely critical, and you can make a difference with it. So there's a lot of different things that you can do with your day-to-day, like getting light exposure in the morning, having a certain routine at night, and there's so many things that you can do to optimize sleep. It's really, there are generic things that can be really helpful, and then there are some things that you tailor. Immune dysregulation, right? That's the third component. Chronic stress can also be a real issue there, because if you have chronically elevated stress hormones like your cortisol levels, your adrenaline's always elevated, that can also create problems for your immune system and immune dysfunction. So we want to try to look at everything that we possibly can for someone to put together a good immune-based protocol based on the latest science, the environmentally induced model of autoimmunity. Now, you can do testing. You can do a lot of testing to evaluate the barrier systems, to evaluate the triggers and look for antibodies, and take out specific foods from your diet and look for specific pathogens and try to get rid of those if they're present, to evaluate for chemicals and then work to get those out of your diet. You can look at the vitamin and mineral status, the essential fatty acid status, all those things we've talked about. You can quantify them through testing. You will, depending on how deep you want to go with those things, you can invest quite a bit of money, but it helps to give you a very unique fingerprint for what is happening to you so that you can tailor a protocol specifically to your needs. Now, you can also say, all right, what type of diet generally works? What type of supplementation protocol do you see that a lot of people commonly need? What type of lifestyle changes do you see that people commonly need? And so that's something that I'm going to provide to you. In the links below, I have free access to the dietary program that I typically use for people, including it's preloaded with the supplements that I typically use. Also, as part of that dietary program, there's an app that you get access to. It's totally free. There's no strings attached to it at all. We're not going to spam you or message you or any of that crap. It's totally free. Have at it. I want people to make change in their life and to be able to live a better quality of life at the lowest cost possible. If you want to go in depth and you want to get testing and you have a budget to spend a few $1,000s or more on testing, we can get very advanced immune-based testing, and that's great. That can help you. That can be helpful as well. But that is not where everyone needs to start. Anyone can start with the simplest things like just diet alone. So I want to make sure that you're aware there are options, and I'm going to give them all to you below. So you can take this strategy. Now, with psoriasis in particular, there is, the scientific literature shows us that there is dysfunction. There's dysfunction in a particular type of immune cell called a dendritic cell. So the dendritic cells, they are cells that sample your intestinal environment. So what they'll do is they actually migrate in the bloodstream to the intestinal barrier wall, and they stick an appendage. It's literally like a finger-like projection into the intestinal tract. They sample the environment, they take it back, and then they take like the proteins, the bacterial fragments, the intestinal environment, they sample it and they take it into the cell, and then they take it to lymph nodes where it is shared with the rest of the immune system basically, and then it is determined in the lymph node if an immune response needs to be mobilized against things that are in the intestinal tract. So there's dysfunction with these dendritic cells. There is barrier system dysfunction, and then the immune system starts to react in psoriasis against a part of your melanocyte, the cells that produce your the melanin, which gives your skin like a darker color. And that's actually an autoimmune target for psoriasis. It's the melanin. It's part of the melanin. It's a complex in there, but this is part of the pathophysiology of it. But if you apply this general model, this model, which the great thing about it is that this general model applies to all autoimmune diseases. So everyone has their own unique triggers and drivers of the autoimmune disease, but in general, this is the way that with the things that we know trigger and drive it. So there's barrier dysfunction, there are triggers, and then there's immune system dysregulation. If we support all those things, a lot of times we can make a difference without the drugs and the medications. Now, some people are going to require biologic medications. I've worked with many people. I've worked with people, and we have done every test under the sun, and we cannot dampen their autoimmune process enough that we get them to a point where they are in remission. And that's the ultimate goal, is when you're in remission. Now, most people, we can make significant improvements in their autoimmunity, in psoriasis, their plaques. We can improve them significantly in most cases. but there is a small percentage of people that we cannot improve. And why is that? We don't know. Autoimmunity is not totally understood. All the triggers are not totally understood. It is something that is a major problem, but this is the best model. I'm telling you, I've studied this. I've taken just about every course that's available out there for functional medicine through the Institute for Functional Medicine, the American Academy of Anti-Aging Medicine, the Karazian Institute. I've taken from who are the best of the best. And I mean, there are many great people out there that I'm sure I could learn more from, but there is no cure for autoimmunity. So our goal is to dampen that autoimmune process and try to put it into remission. And I'm telling you, with psoriasis, I've been able to do that for myself. Many people that we've worked with are able to significantly improve and dampen their autoimmunity. Now, can you get it totally into remission? Maybe, but that's not something that I would say should be your ultimate goal. I mean, you want to work towards that, and if you can do it, fantastic. But if you can't, don't be frustrated. You're going to be able to, if you can dampen it significantly, that usually makes a world of difference. So for me, I don't have any visible plaques. I have a few, like a little spot here. You probably can't even see it, but on my knuckle here. Occasionally I'll have a little bit come up, but it used to be on my knees. My elbows were severe. I had it breaking out on my palms, and it's totally gone. In about 6 weeks, I was able to do that. Now, with a lot of people that we've worked with, we see those same types of results, but we can't, there's no cure-all. If anyone's telling you that they can totally cure you, they've got it all figured out, that's just not true. And if it is true, I want to know who they are, because I want to learn from them. And so what I want to do is share with you these tools that I know can work for a lot of people. If you need help, feel free to reach out to me. I will do anything and everything I can to help you. So below, there's going to be a link to my dietary protocol that I commonly use with people that are autoimmune and that have psoriasis. The supplementation is preloaded, the supplements that I commonly use with people that are usually needed, which is totally optional. The supplements are in there, it's totally optional. As part of the app, once you log into the app, I have programmed in to send you information on how to optimize different aspects of your lifestyle. You can even click and look at some of the other tabs that I have in there. I have information on sleeping, on exercise, and a few other things for you to consider. As far as testing goes, anytime someone orders testing through me, we give you testing at our cost. So there is a lab shop. It's called a lab shop. So I've partnered with a company that I order when I work with people via telemedicine all across the United States. I use a company called Rupa Health. Rupa Health is fantastic. They're a concierge laboratory testing company. They charge a very small processing fee, but they allow you to, and I don't get paid anything from them at all, I want you to be very clear, but they allow you to, as a concierge service, they send out the test kits, they track them. When the results come in, they send you the results. They send me the results. And so this is a fantastic way for me to tell people, like, look, these are the tests that you need, that you can use. And if you want to self-order them, you can, because I can tell you now, your doctors, your primary medical physicians, and even your specialists are not going to know this information I'm sharing with you. They are not trained this in medical school. To learn this information, they have to go outside of medicine. They're not going to get it through medical continuing education. They have to go to groups like the Karazian Institute, the Institute for Functional Medicine, the American Academy of Anti-Aging Medicine. They have to go to Functional Medicine University. They have to go to these specialty laboratories, these specialty educational groups, and learn this information, because there is no medication that these groups do not teach you about a medication to use, because this is actually looking at the drivers of the disease processes. Now, it's not that your doctors don't want to know this, but even if they're aware of what I'm sharing with you here, they cannot give you that information. They don't have time to. There's no way to bill for it. And guess what? Most of them are corporately owned. They are employees, and their hands are tied. This is not, trust me, this is not what they signed up for. So if you feel like you're trapped, don't despair. I'm going to give you everything, and if you have questions, post them. You can just click on this video wherever it's posted. It's probably hosted on YouTube. Click on that video and then ask questions in the comments. I will look for them. I will respond. If you need further help, I'll do everything I can to help you. If you want to work with me via telemedicine, just click on the telemedicine link. You can learn about it. There's an application process, because if I don't think I can help you, I will not take you on. But I will not leave you hanging. I will actually give you my thoughts and try to give you direction if I can't help you beyond that. So with that said, I hopefully have been able to lay this out for you here, the dietary strategy, the supplementation strategies that are commonly needed, and then the testing options that are available. And then if you want help with any of this, I can work with you via telemedicine to help you tailor the supplementation specifically to you. If you want to get testing, I can help you lay out several different tests that may be helpful to help us identify specifically your immune-based triggers so that a protocol can be tailored directly to you. And I can help you line itemize those so you can understand costs, prioritize them, test 1, 2, 3, 4, 5, so that you can get an idea of what kind of cost could be involved. And then also, if you decided you want to get those tests, you could choose based on what type of budget you have as well. So there's a lot of things you can do for totally for free. Totally for free, and I want to make all those available to you here. But this is something that's near and dear to me, personally having psoriasis, my mother having psoriasis, and having psoriatic arthritis, which she has caused her to miss a lot of things in life, a lot of things with my kids and her grandkids, because her knees, her body weight, and just feeling terrible. And I want to do everything that I can to help people help themselves. So I'm here for you. If there's anything I can do, please let me know. Just reach out to me, and I will give you every bit of information and anything free that I can. And if you want some help, then I'm here for you there too. But I appreciate you taking this time. I hope this helps you. And listen, if you do better, do me a favor. Take pictures. If you decide to do some of the things I'm telling you here, take pictures of your psoriasis. And then once you go through this protocol, share them with me. Please let me know, because it helps me to keep going, making information, putting out information for people, spending my time and doing this to see people getting results from the things that I share. So I appreciate you so much. I hope you have a wonderful day. Thank you for visiting. And if there's anything I can do, please do reach out.